Hello, good morning, everyone. I'm really happy and honored to have you all here with this very high-level panel about Pan-African governance of the healthcare sector in Africa. So this panel is part of the healthcare stream at AFSIC London 2021 this year. This is a hybrid event about investment in Africa. It's many sectors, and this year, in collaboration with Tunisia Health Alliance and Merck, we've taken in charge all the organization of the healthcare stream. So I'm really honored to have Dr. Michel Hamala Sidibé as a moderator for this panel, and he's former executive director of UNAIDS and Undersecretary General of the United Nations Africa Union Special Envoy for the Africa Medicine Agency. And this is a very big challenge and project for the whole continent. And you'll be talking for sure about this today. And then as speakers, we have Lolem Ngong, who is Chief of Staff of AMREF Healthcare Africa today. So Lolem is a seasoned global public health professional with more than 15 years of leadership in global health diplomacy and coordination of strategic partnerships in order to address threats to public health, among others. And then we have with us Mr. Greg Perry, who Assistant Director General of the IFPMA, that he joined in February 2018 and has the responsibility of the organization's external outreach and stakeholders engagement in global health topics, including innovation, access, Africa engagement, and regulatory affairs. And I think, yeah, one of the hot subjects here is access to vaccines and medications across Africa. And then we have Monsieur Benjamin, who is from Africa, Monsieur Benjamin Jubaide, who is Head of Division of Policy, Head of Diplomacy and Communication, Africa Center for Disease Control and Prevention. And I guess you've been, like all the others, very, very busy in this special period. So he has like more than 15 years experience in public health in Africa. He has been appointed in May 2020 Executive Secretary of Africa Union COVID-19 Response Fund. And last but not least, Mr. Emmanuel Batz, who is Director Middle East and Africa Bioprocessing from Merck Group. So he's director within the Life Science Division of Merck since 2016. Before that, he held various market development and region management leadership. And one of the biggest subjects working on Manuel is like putting on a kind of turnkey solutions for deployment of vaccines and medications across Africa. So yeah, I may be gonna hand it back to you, Mr. Michel Sidibé, and the floor is yours to manage this panel now.
Thank you very much, Kais. I am very happy and I'm so lucky to have such a panelist with me today. And I think the topic we are touching today, it is timely and it is topical, talking about health and transforming Pan-African healthcare system and reaching the people who have not been reached by services without thinking about governance system will never work. So today we want to really listen to each of you about, of course, these governance issues, how to address them, how to make them responding to the demand of the majority of people who are left behind. My first question will be, Roland, excuse me, I would have started with you, but I want to provoke Benjamin. You know, Benjamin, when I reflect on this all governance issues, sometimes I ask myself, is it utopia or realistic to look for a unified and integrated African healthcare system? And do you think the model, reinventing the model is needed? If yes, how we can do it?
Thank you very much. Thank you very much, moderator. And I am pleased to have you here with us today and the other colleagues on this call. Before maybe responding to your question, I need to clarify what me personally I understand by governance. And for me, the governance has 3 dimensions. The first dimension that I can see is the authority. The second is the decision making, and the third one is accountability. So if you put it together, then the governor has is defined or referred to structures and processes that are designated to ensure accountability, transparency, responsiveness, rule of law, stability, equity, and inclusiveness, empowerment, and broad-based participation. So this is what I see as a government. So now when we bring it back to an institution like the African Union, what is governance for us? And we know that in Africa today, we are at a very pivotal moment today. We have the integration with this different aspect of the integration, the free trade area, the open skies, the free movement of people. We have also another pivotal moment is our population. We need to look at this governance in the context of the African population today. 1.3 billion people with a cumulative GDP of 3.7 trillion. That is extremely important for us. And the projected population for this continent by 2015 is 2.5 billion. The urbanization, the rural area versus urban area. What governance means for these people? Because by 2013, we will have more urban population versus rural population. What governance means for these people? The climate change issues. Again, we need to take into account in the way we frame our health systems. The conflicts that are fueling the movement of peoples on the continent, all these different aspects, we need to look at them. Now, the combination of emerging diseases, endemic diseases such as HIV, TB, malaria, and non-communicable diseases, including injuries, lead to something like 800 billion in productivity loss on the continent per year. So we, as Africa Centers for Disease Control and Prevention, we are guided by the 2063 Africa that will be rid of all neglected tropical diseases and communicable diseases, including infectious diseases such as Ebola. And we want to bring them fully under control with robust integrated health system to reduce these diseases, and also the lifestyle of the continent should change, including all these non-communicable diseases. So this is, I just want to frame it, how we want to see the governance addressing the challenges of the health system in Africa. So we need to bring them back into that context. Thank you very much.
Thank you, Benjamin, but I want to come back to you quickly, if you allow me. You know, we know that out of pocket is so high in our continent. Poor people continue to pay almost 30%, use 30% of their resources in health, and pushing them in extreme poverty. What you think this governance system can help us to deal with these critical issues? For me, it's so critical, and most of them are without voice. I will come to Laurent for that one.
Thank you very much. You are right. That is the accountability aspect that we need to look at it with all the domestic health financing that is being put in place by the head of state and government of this continent. And today we have His Excellency President Kagame of Rwanda, who is the champion of the domestic health financing of the continent. The continent, we have started since 2001, all the head of state and government committed to allocate at least 15% of their GDPs to the domestic health financing. But as of today, only 6 countries have reached this 15%. So the majority of the countries on the continent are depending on the external resources to fund their health system. That is not predictable nor sustainable. And this is not the direction we should go to. So that is why on the continent, a huge work is being done in order to ensure that we have the schemes in place to sustain the people. Different models in different countries are being put in place in order to reduce the out-of-pocket expenditure, in order to not push people into poverty. And that is what we are seeing happening on the continent. So there is this scorecard that is being put in place that is tracking the domestic health financing of different African countries. There is every year when the head of state meets, they look at this, how are we doing? So this, and we are using the EdWatch Africa platform to sensitize the head of state and the government for them to know that we are not comparing countries, but countries are compared against themselves. How are they, for instance, performing in 2020 and 2021, so that they can see how best they are doing it. And there are some set of indicators to help us follow the resources that are being put in the domestic financing. So now we have moved to establishing what we call the regional health financing hubs, and the regional economic communities are going to host them, and the piloting will start in SADC region and the East African region. The second thing,
Benjamin, will come back to that one. I wanted to just jump on, of course, Lolen nicely to say that what Benjamin said, you heard. You know, we are trying to rethink this whole governance system. We are trying to look at, but one of the key issues is the problem of accountability, is a problem of transparency, is a problem of making sure that each dollar invested will at least produce a maximum of return in terms of quality health, in terms of accessibility, in terms of reduction of death, because ultimate goal of public health is to reduce the death. Mm-hmm. So what do you think a report or what AMREF is doing every day to push those agenda, what do you want to share with us? Thank you, yes. Benjamin. And Lolen, you have the floor.
Thank you very much, Dr. Sidibe. You know, this is really, and I think as Benjamin said, it's a very important and hot topic, given everything that is happening on our continent. And I'm glad that Benjamin started with, you know, us really thinking about health holistically on the continent. So even including climate change and even some of the conflicts around our continent and how that impacts health. So, you know, at AMREF, we did last year, actually beginning of this year, we commissioned 11 experts around the continent, so from every corner of the continent. And the task that we gave them was to really look at the state of universal health coverage on the continent and look at how have we progressed as a continent. What more do we have to do? And, you know, are we actually going to achieve this in 2030? The short answer is, of course, we're not going to achieve this in 2030, given already some of the reasons that you yourself have stated. We still find that out-of-pocket costs on this continent are just unacceptable. In this report, we found out, I mean, part of the surveys that were done, one of the results was, you know, almost 100 million people on this continent incur catastrophic health expenses annually. But when you think about it, and when you go back and look at UHC policies in all of our countries, 93% of African countries actually have a health sector UHC policy or include UHC as a goal in their policies and strategies. And then, you heard Benjamin talk about the scorecard and all the efforts that the African Union is doing. And so it just begs the question, where are we going wrong? Where are we not seeing the progress as we're tracking government investments?
Where are we going wrong? Lolen, where are we going wrong?
Yes, I think where we're going wrong, in my view, there are two things, and the report also brought this out. So one is we can't just talk about universal health coverage as a check mark. We have to talk about universal health coverage as an implementable, if I can use that term, goal. So how do we implement it? So our governments need to actually sit and have frameworks around universal healthcare, right? I mean, we see in Kenya, universal health coverage is one of the president's big four agendas, which means that there's an actual government machine that is very heavily steeped in ensuring that we do reach proper access for Kenyans, right? And so you see all the social insurance schemes coming. You see the government investments in it because it's been translated into a bite-sized, achievable goal. So for us, we've been looking at what are those tools that we can give our governments. Using an example like Kenya, how do we now replicate this for our other African countries? What tools do we give African countries, the government, civil society, private sector? Because private sector can't quite find its home without complementing the government, right? So the government does have to have these frameworks. So I think that's one area we're going wrong, is that we talk about it, but we don't have an action plan. The second thing that the report really brought out is also this issue around financing. We cannot keep going on with the majority of our health system funded by external donors. It just doesn't work. It doesn't work for sustainability. It doesn't work for creativeness. It doesn't work for the innovation that our health systems demand. So now we will be looking to our colleagues at the African Union as member states gather to say, do we need to revisit, these Abuja agreements? Yes, we put 15%, but most African countries have not gotten to even 5%. So now we will look at the AU for that leadership to say, how do we now actually invest in our own health systems? I think COVID has really been a blessing in disguise because it's shown that really, if we don't invest, we will be left out to dry. So maybe I'll just stop there and wait for more questions.
Before going to Manuel and Greg, I want to provoke both of you. Excuse me, I'm just facilitated by listening to you. So no, I want to hear from you, what could be the role of private sector? Because we are talking like if government, state will be able to deliver, to go, to make sure that. So we experience taught us that government is very good on normative level, but when they play this function properly, but sometimes they are very limited on delivery, on implementation. And so what do you think? And we are not seeing private sector, completely being involved, or most of the discussion, or we are missing them. And Benjamin, you can prepare yourself. I didn't hear in this architecture about, I know Lolen would have loved to talk about that also, community health care. Because for me, it is a missing link today. The interface between the last provider of services and people who demand services, if we don't have those community health workers in the architecture, something will be missing. So I want to hear you.
Sure.
The one who want to start, maybe let Benjamin provoke on that first. Okay. And then Lolen, you will come and I will move on certainly Manuel.
Sure.
No, definitively, Michelle, thank you very much for bringing out this issue of community health workers. And this is what we are calling, the last mile, the missing link, to get the services down to the communities. If we get it wrong, then we will get. And you will recall when you were the executive director of UNAIDS, you pushed the head of state of the government to endorse the 2 million Community Health Workers Initiative. And this Community Health Workers Initiative has been effectively endorsed by the head of state and government, and it is being today implemented across the continent. And the COVID-19 pandemic today offers a unique opportunity, really, to put it at a real test. And that is what we are doing today. Today, on the continent, we have close to 100,000 community health workers that have been deployed by Africa Centers for Disease Control and Prevention. And while deploying, we are learning also on how this can be extended really and scale it up. Because we know that the community health workers are close to the populations. If we don't use them as extended part of the health system, then everything that we will fix, we will not. It will defeat our purpose, because we cannot cover with trained medical doctors or nurses or midwives the entire population of this continent, 1.3 billion. If we do the simple mathematics, it is just not possible to cover in terms of human resource the need. And that is one of the pillars of the new public
governance system.
Exactly. And that is extremely important, because if we don't have a sufficient, large and well-prepared workforce, we cannot really implement. And
thank you, Benjamin Lolen, because I will move to Manuel and Greg.
Yes, sure. So I think for private sector, I mean, for me, just what came to mind, 3 areas. We need private sector, obviously, to invest in health. And I should actually correct that and say to co-invest in health. And you're absolutely right, Dr. Sidibe. Government is there to set the norms, right? To set the norms, to set the policies. Government is also there to help us convene. And when I say convene, I also mean bringing in the private sector to say, here are the gaps in financing. Here's where we think private sector will be extremely influential. We also need private sector for innovation. We've seen that during COVID in reaching this exact last mile that Benjamin mentioned. We couldn't train community health workers in person during COVID. So we had to come up with mobile apps, AMREF has 2 that we came up with in order to ensure that community health workers were constantly getting new information on what is COVID, sensitizing the community and so on. So we need private sector to help with those types of innovation. The government is not going to do that, and actually the government shouldn't. So the private sector has a role to play in bringing that sort of digital health and other technology to life. And then the last part is even in this delivery of services to the last mile. We know, I mean, even if you look at just, if you look at faith-based organizations around the continent, so many of them have one of the best health services in many of our countries. I mean, I know in Cameroon, for example, where I'm from, the largest and best provider of health services is the Cameroon Baptist Convention. Private sector, also the Catholic missions. So how do we use them to make sure that they're playing their role in delivering healthcare to the rural populations, especially? I mean, they're in every bit and corner of our countries. So that's where we need private sectors. And those are the 3 areas where I really see a need for private sector.
Excellent. I want to just, because, the debate is so interesting that I want to get the maximum out of you. I heard you talking about sustainability. I heard you talking about making sure that what we are building will be there for our children and our grandchildren probably, and will help the people who are living today to live in better condition. But when we talk about private sector, are we talking about a private sector coming from abroad? Are we talking about making sure that our own private sector will start to mobilize themselves and become an effective force of this governance system. And then I move to Manuel. Manuel, I am managing time, and Greg, the time they give to me, I meant to make it useful for all of us.
Did you?
Please, Lola. Yes.
Oh, sure. Yes, I think.
Or Benjamin, or Greg can, or Manuel, anyone who wants to jump on this question can come.
I could say really quickly that I think we are at a really fantastic sweet spot where our homegrown private sector now has to step up. I think we've relied extensively on external private sector, like we've relied and whether it's the FBOs that I mentioned, but we've also relied on the Coca-Cola foundations of the world and Google and Facebook and all these other Philips. Meanwhile, we do have private sector on this continent that can step up, and I think that whether it's private sector or philanthropists, I tend to sort of link those. I think there's an opportunity to really define and maybe even formalize our own corporate social responsibility, right? And whether it's working with our homegrown private sector so that they find their niche and they also define what they can do to see it as sort of a charitable thing, right? So we build a borehole here, and we build, a well, we build a school, no, it has to be large scale. They can also bring about innovation, and they can also ensure that they are working very closely with the government to also co-invest in health. So I think our own homegrown private sector have to see themselves that way. And I don't know how we get them there. Maybe Benjamin or Greg or Manuel have ideas. I don't know, but I just know that's where they need to be.
Thank you very much. I think we talk about a different governance structure. We could have broadened that one. We could have talked about a budget allocation, budget utilization, and how we can also mutualize capacities from a different part of the continent, how we can really improve research and development, particularly Africanized research and development. That brings me to Manuel. Manuel, you follow with all of us the challenge we have been faced with. I think the world, but particularly Africa is still now, I think Benjamin and CDC and others, they have been advocating very strategically and very strongly to make sure that we can get the vaccine and we can vaccinate our people. And we saw that a vaccine was not made available, because when we have less than 3% or 3% maximum of our people who are fully vaccinated, when we know that more than 1.2 billion people didn't get even one dose of vaccine, we know that the risk is not only for the continent of 1.3 billion people, the risk is for the world. Because if this virus escape from the vaccine and create a mutation or mutated, it will be very painful for all of us. So I want, Manuel, I know you know very well the situation, so I don't want to describe to any of you. If you can share, with us a little bit, which technology we can bring to Africa to resolve the problem of one of the key problems I was advocating for all my life is local manufacturing, reducing dependency, making us more resilient, because my experience with HIV taught me all those things. So how we can really be able today to resolve these local manufacturing issues from your perspective? And you heard Benjamin talking about hub of excellencies, trying to diversify a little bit our capacity to produce, but I want to hear you.
Thank you, Michelle. Thank you for the invitation to this important panel. I'm working for Merck KGaA, and we are a key technology provider for the private sector in Africa to empower them to build biomanufacturing capacity, namely vaccine manufacturing. And we have been engaged in this for many years already before the pandemic, and we have been proposing to start with a formulation fill and finish as a first value-adding step into vaccine manufacturing. It is a complex process, and we advise to start in phases. Otherwise the risk of failure is quite big. So the pandemic has revealed that that Africa needs to build its own asset base to manufacture vaccines in the long term. Otherwise, you are left out, and only 3% of the population is vaccinated against COVID, as you see. So this has been acknowledged by all the actors, international and also local. And now, of course, there is like many projects coming up. A lot of money is being not spent yet, but at least designated to be spent from the European Union to many other stakeholders, and we are engaged in many of the projects, and we are also advising on the best way to realize. From our perspective, from a governance perspective, of course, you need a regional coordination. It will not work that you have, like in every country, a vaccine manufacturing plant. So there needs to be at African Union level a coordination, and there is the PAVM initiative already kicked off to make sure that that investments are not in vain. Yeah, there's a coordination. You need also a coordination on the regulation of the vaccines. Yeah, this should also be harmonized to avoid then problems when you cross borders. And then there is one aspect that we believe is a key that is not really addressed enough at the moment. It's about the offtake mechanisms. The vaccine market is not a private sector market.
Offtake mechanism. Could you explain a little bit, Manuel, what means offtake mechanism? Because people who will be listening to you in the room will need to understand.
Sure. Offtake mechanism. Whatever you manufacture, fill and finish in Africa needs to be bought up by someone. And it will not be the private sector to buy it. It will be either the governments or the donors or the African Union. And this has to be considered already when you decide to put money into equipment and buildings. And this is something that we believe is key to have sustainable manufacturing. And of course, and now when I'm close to finish, there are two markets that we see at the moment. It's the donor-driven market for routine immunization for the infants. Millions of doses are donated and go to Africa. These should be considered in looking into the viability of having local value-added manufacturing. And of course, the pandemic, the supply of COVID vaccines through this asset base for this pandemic and for the future as well, to be better prepared than this time, to have a warm capacity across the continent that can kick in and be ramped up so that the continent is not waiting 2 years to get any vaccines. So,
Manuel, if you were giving advice to Benjamin or to Lolen or myself, what could be the 1, 2, 3 things to not miss to do to really move quickly and try to bridge the gap on the vaccine and local manufacturing or even medicine? What do you think are the 1, 2, 3 things you would have really advised to leaders, to people who are involved daily on implementation?
It is, as I said, when you have such a local vaccine manufacturing project, to engage early with the donors and tell them, how can we use these assets to channel part of the demand through this manufacturing, so that you have a capacity that is utilized also between pandemics. and then as well with the international community to see that for the pandemic, for the current one, and I think the virus is here to stay, and we will all need regular booster shots going forward. How this can be how this can be the local capacity can be utilized for that purpose. Yeah, that's.
Thank you very much, Greg. We are so happy to have you here today. I think you have been listening. You have been great to wait for the question, which seems for me certainly the missing point in our today debate. I can see that most of the situation we will be dealing with will never be resolved. We will never have a well. I can say that strongly, a well-functioning health ecosystem without a strong regulatory system. So what do you think African Medicine Agency could bring in this debate, and how we need to leverage that, and how you're seeing, of course, like I used to say in French, CDC and AMA, c'est les deux poumons d'un même corps. So it means, without ces deux poumons, the body will not work. So how you're, what do you want to bring in the debate before we conclude? You have the rest of the time if you want. Greg, you're on unmute, please. Voila.
Yeah, the classic. Yeah, I was saying is a great debate so far, and great questions. And I'm speaking, the week after we got 15 final full ratifications of member states of the African Union. So, essentially the AMA is born. And also congratulations to yourself, Michel, for, as being the African Union Special Envoy. Great work that's been done. And this is critical. It's critical to local production, for example. It's critical for ensuring that we'll have quicker access and availability for patients for drugs and vaccines. It's going to be critical for dealing with falsified medicines and counterfeit medicines on the continent. So a whole range of issues are key to this. And of course, regulatory strengthening has always been a key component of the African's manufacturing pharmaceutical plan. So a lot of work has been done leading up to it, as we know, through the African medicines regulatory harmonization and all the regional activities. But this really is a milestone. And of course, it supplements the work of the African CDC. And the African CDC has shown such immense leadership in the COVID pandemic. I think a lot of us from the rest of the world can learn from it. And has also shown immense leadership in getting this this partnership for African vaccine manufacturing up in the road. And I think this shows that Africa is really moving in the right direction from a governance point of view. We have one African CDC, great government structure. It's now going to be supplemented with the other arm of the African Medicines Agency. And I think from the private sector point of view, seeing these significant steps in governance and in leadership are fundamental for the way in which we can be involved, whether we're a global industry or the local industries, in moving forward. So, this is a fundamental step.
Thank you very much, Greg. But what could be the contribution of private sector, contribution of your structure and others? For me, I just want to say that thanks that we have been supported by all the different players, private patient groups and states, particularly leaders, political leaders, to make ratification possible. But it is the first step. Now, the second step is managerial, is to put this structure in place. But what could be your accompaniment on this?
Yeah, Michel, very, very, very important point you've mentioned. This is just the first step. And what now needs to be done is to put a proper governance structure into place, financing and, an appeal here to the African Union members, the African Union itself, as well as potential partners like the European Union, to help finance the long-term sustainability of the African Medicines Agency. From the private sector, we will be users. We have set up a cross-stakeholder group called AMATA, the African Medicines Treaty Alliance. It's a stakeholder group including patient organizations, academics, NGOs, and users, the industry. And we look forward to engaging with yourselves in trying to move forward on the structures. And I think it's very important that the African Medicines Agency has an open dialogue and a governance structure which enables patient organizations and users to be involved, just as has been the case in the European Medicines Agency. And just coming to a sort of a tangent from what you're saying, but what was said before about, are we looking at the role of the global industry or the local industry? Well, to be honest, obviously within the regulatory structure, but in the whole of access to medicines, it's both. There's room for both, and local industry and global industry can cooperate. They do cooperate. We'd like to cooperate more. There's joint ventures, there's tech transfers, there's contract manufacturing. But key to the future of Africa is clearly having a very strong private sector in the health industry. And that needs to be developed and move forward. We've seen some moves from the global industry, J&J's agreement with Aspen, Pfizer BioNTech with BioVac, Moderna's announcement recently. These are all great initiatives and can be built upon. But I think a lot of people, I personally, and I work also with the local industry for a long time in the generic area, you need to have a strong local industry. And that requires, and my final point, the government's role is indeed normative and to set all the structures in place, the ecosystem for that private sector to work. And that is the way forward, I think.
Thank you very much. I think that was a lovely debate, and it is just a beginning. And I hope we will have an opportunity to really continue this discussion on governance issues. The only thing I can hear from all of you, I heard a lot of things, but what I will take with me is that in fact, health is not an expenditure. Health of our people is not a cost. It is an investment, and we need to be prepared, and we need to reorganize our governance system, and we need to engage all the different actors to make sure that we can really reach our goal, and which is, of course, universal health care, but also making sure that the equity issues will be addressed, and we will not be surprised with the next emerging or next pandemic, and we'll be better prepared to be able to produce locally and to share our own goods with our own people. Thank you very much for giving me your lovely time. It's 45 minutes. I hope you enjoy it.